Hi there everybody, and welcome to Radfield Home Care's Coronavirus Focus with myself, Ed Gill, Radfield Franchise Recruitment Manager, and our co-founder and franchisor, Dr. Hannah MacKechnie. Hannah, welcome.
Thank you.
No problem. So in today's episode, we're going to be answering some of your questions that you've been putting to us in recent weeks about the impact the coronavirus pandemic has had on the sector and operating a home care business. So the first question we have, Hannah, is from Gaynor in Chelmsford. And Gaynor has asked, in your last episode, you mentioned the impact of PPE on clients and carers. However, I'm interested in setting up a home care business, but worried about the impact PPE costs will have on my bottom line. Are you able to offer any advice to Gaynor on that particular topic?
Okay, Gaynor, I'll do my best. Right, well, with PPE, as we've discussed in a previous episode, obviously the cost during the coronavirus pandemic did increase significantly. What we're seeing now is those costs starting to come down quite rapidly. So now we're looking at around sort of a drop of 75 to 80% of the costs as they were at the peak of the pandemic. So already those costs are really settling quite significantly. So in terms of the effect on franchise partners' bottom line, yes, absolutely. At the beginning of the pandemic, when the supply chain was very stretched with PPE, then the cost obviously escalated, and that did impact our franchise partners. However, subsequently, a lot of local authorities, and it does vary area to area across the country, but a lot of local authorities have actually provided grants and in lots of cases actually paid entirely for that PPE excess that our franchise partners have had to fund. So although they did have to outlay that money initially, a lot of them have now recouped it entirely. In terms of the future of PPE costs, I would say that we are still seeing that cost come down, so I would expect it to continue to fall. Not entirely sure whether we will ever see it settle back to pre-COVID levels. We will just have to wait and see on that one, I would say.
Okay, brilliant, thank you. So again, hopefully that's giving you a bit more confidence in the impact it will have on your bottom line, which by the sounds of things won't be too drastic as things progress. The next question we have, Hannah, is from VJ in Birmingham. And VJ has asked, are your offices still opening during the pandemic? If they aren't, how has that impacted operating the home care business? And if they have remained open, what measures are in place to keep clients and staff safe?
Okay, well, VJ, I would say really in answer to that, it's a bit of both. Some offices initially we encouraged to not necessarily close, however, some that were operating in serviced offices did experience that the entire serviced office closed temporarily, so they had to close really by default. For other locations that weren't in serviced premises, they could choose whether to keep their office open, and what a lot of them did is just operate a skeleton staff within the office, so maybe just the care manager and one other person, and other office team members would be working from home. So set up remote working, and then obviously the business carries on as usual, but we just limit the number of people physically present in the office to minimise the possibility of spread of the virus. Carers often need to come into the office to communicate issues or pick up supplies, so controlling that was key as well, so making sure that the routine infection control measures that we're used to seeing now everywhere as shops have opened, so clear signage, social distancing measures, hand washing, hand gel, etc., all in place to make sure that when carers and also relatives of clients come into the office, that we can ensure that their safety is paramount.
Okay. Brilliant, fantastic. So again, VJ, hopefully that's answered your question there surrounding offices and how that's been managed during the recent weeks. Another question we have from Nicola, near Guildford, is I set myself a goal to open my own home care business in 2020. However, should I wait until there is a vaccine or more clarity surrounding the pandemic?
Well, Nicola, I think this very much comes down to your personal circumstances and how confident you feel in terms of whether you're ready to open up a business now or whether you would prefer to defer. What I would say is that we're seeing new franchise partners coming through and setting up their businesses at the moment, so there's no reason to defer. We provide full training and make sure that obviously our franchise partners setting up understand all of the infection control parameters, the PPE requirements, the government guidelines, etc. So we will ensure that all of the policies, etc., are updated for you. So there really is no reason why you have to defer, but I would say it really comes down to how comfortable you feel about operating in the current climate, or whether deferring is the right decision for you. Yeah. So really back to you on that one, Nicola, I'm afraid.
Yeah. But like you mentioned there, Hannah, it sounds as though actually setting up a home care business within the support of a franchise network will give you a lot of extra support surrounding that as well, and take some of those pressures away from you from keeping up to date with the policy and procedures.
Absolutely, because the amount of guidance that's come out during the pandemic has been huge. Yeah. So, having to, for each individual franchise partner, if they had to go through that information and digest it and pull that through into meaningful policies and operating procedures and into manuals, etc. That's a very, very tall order for an individual business to do. So being part of a franchise network, we can lift all of that work away from our franchise partners so they can focus on the important work of caring for their clients and ensuring that their carers are safe and working well through the pandemic.
Brilliant. So Nicola, hopefully again that's answered your question for you, and best of luck really with launching your business, hopefully in 2020 or 2021. A final question for you, Hannah, is from unknown. They haven't left their details unfortunately, but they've simply asked, is the CQC still registering home care businesses?
Okay, the simple answer to that is yes, they are. Okay. During the pandemic, CQC have slightly changed their regulatory structure in terms of their routine inspection regime has been deferred. What they've done instead is defer to their emergency framework. So they've been contacting every home care provider to make sure that they are operating safely, following all the procedures and ensuring that obviously client safety and carer safety is being looked after. So yes, the CQC are still very much in touch with home care providers, despite not doing that routine inspection regime, but they are still registering new providers.
Okay, brilliant, fantastic. So again, hopefully that answers your question there surrounding the CQC, how they're registering and how they're managing providers during this time. So in our next episode, which is our final episode of the Coronavirus Focus, we will be looking at what the future holds for the home care marketplace in light of the coronavirus pandemic and the changes that have been made in recent weeks. If you do have any outstanding questions, please do still send them across to franchise@radfieldhomecare.co.uk, and we will do our best to answer them in that final episode next Friday at 1 o'clock. Otherwise, we look forward to seeing you then. Thank you.